Woman, an in-depth exploration of the world of women today with Sandra Elkin.
Good evening and welcome to Woman. Our topic tonight is feminist therapy. Some people think feminist therapy is just another fad. Other people think it's the only kind of therapy that women should be considering these days. My guest tonight is somewhere in between. She is Pauline Bart, Associate Professor of Sociology in the Department of Psychiatry of the Abraham Lincoln School of Medicine in Chicago. Pauline has published many papers on sex roles in health issues, such as Portnoy's Mother's Complaint, a paper on depression in middle-aged women. Pauline, welcome to Woman.
Thank you for having me.
I think the first thing we have to do is to define feminist therapy.
Well, I'll give you my definition, although as I think we'll learn, different people have different definitions, although there are many points that they would all agree with. Feminist therapy sees the source of the woman's problem outside her head, in the society itself, in the sexist institutions, and for some feminist therapists who are politically radical, in the capitalist institutions as well. This is in contrast to traditional psychotherapy, which focuses on the inside of the person's head, or as they say, intrapsychic variables, which are supposed to stem from her relationship with her mother and father as she grew up.
Do you think we could use a definition of feminist therapy to screen out the frauds?
No.
No?
Anybody can say anything. I think that therapy is a business, or it certainly can be, and I think, as some people have pointed out, if people are losing their clientele because their clientele, their patients, whatever word they want to use for them, are looking for feminist therapists, then they will say that they themselves are feminist therapists. And it seems to me that the best way to see if a person is in fact a feminist therapist is to see if the person is a feminist. And one way to see if a person is a feminist is to see where she puts her energy. Does she put her energy into women? And does she put her energy into causes and into efforts that will improve the life of most women? Does she, in fact, do movement work? And I think those kinds of people are people you can have more confidence in as feminist therapists.
How long has feminist therapy been practiced, would you say?
I would say probably for the past, maybe 4 or 5 years. Because, of course, it developed out of the women's movement.
Do you think it developed directly out of the consciousness-raising process?
It developed out of the consciousness-raising process, but it also developed out of the consciousness of people in the mental health professions that something was terribly wrong with the way the society was set up and what it was doing to women, and in their attempt to provide the people that they were seeing with a more effective way of being in the world. But certainly the consciousness-raising experience was a model for what I think all feminist therapists agree should be the kinds of experience that women should have.
I think it's interesting that throughout the country a lot of different people came to the same conclusions almost at the same time. There was no real leader in this field. I mean, there's no big superstar name that's saying, you know, all right, everyone is going to be doing feminist therapy now.
But there are networks. The Association for Women in Psychology, for example, I think is a major network for this kind of activity. That is a group of feminist psychologists. There are small networks among other people who do therapy. They are in contact with one another. They go to the same meetings. So I don't think it was any kind of independent invention. There are these newsletters, phone calls, people going back and forth, etc. As you know, there were 2 meetings recently, both of which devoted a couple of sessions to feminist therapy.
It has become incredibly widespread, hasn't it?
Yes.
We didn't talk about this before the show, but do you have any idea how widespread it is or how many people are doing it?
No, and again, of course, it would depend on how one would define it, but the centers seem to be in large cities.
There's a Washington, San Diego.
and San Francisco.
Can you describe a typical feminist therapy situation?
Well, let's say the two examples that come to my mind are the case of the depressed middle-aged woman and the case of the rape victim, because both cases, I think, would be treated differently by non-feminist therapy than by feminist therapy. In both cases, the source of the problem would be located outside the person. Now, in the case of the depressed middle-aged woman, what would be looked at is her situation in society in which she was socialized to believe that she could only find true happiness by being a wife and a mother and living vicariously through her children and her husband. And when she finds out that this doesn't work out, when in fact she has no sense of self, she becomes depressed. Now, the traditional therapist, and I remember reading many records of psychiatrists treating such women, is sort of frequently fairly hostile and sort of annoyed with this kind of woman, and she's considered manipulative and hypochondriacal, and in general, sort of a drag. I think he sort of identifies with her children or her husband, something like that. She reminds him maybe of his own mother. The feminist therapist would say, look, society really did you in. It is really a rotten deal. It is not your fault. You know, if you are angry, you sure have a right to be angry because of what happened to you. Let us see what we can do at this point, you know, to make your life a little bit more bearable. And she would also probably try to put this woman in contact with other women in the same situation, because as we in the women's movement say, it's not a private problem, it's a public issue. Our problems are not simply individual because they do stem from the society. And so presumably these groups of women would share their experiences, and in so doing would be able to hopefully arrive at a more comfortable situation. And similarly with the rape victim, she wouldn't be asked what she did to contribute to it. She would be told she had a right to be angry. By the way, I'm not implying that all rape victims need therapy. I mean, many of them can do quite well with support from a sympathetic rape victim advocate. But it'll be discussed in terms of the forces in the society that socialize men so that they feel they're entitled to take what they want sexually, and in no case will it be implied that she did something to contribute to it. I sometimes say that the focus on the intrapsychic, it can be extremely destructive, because it ends up where you ask the person what she did to get herself in what is usually a very oppressive situation, whether it is an oppressive marriage or being raped or being depressed. And I say that, and then she's also asked what she's getting out of it. And I said that that's sort of like asking a rape victim what she did to provoke the rape, and did she come? And, you know, we've been raped by the society, multiply raped and gang raped when we deal with institutions. And what we did to provoke it was to be born female. And like all powerless people, be they colonized Algerians or blacks or Chicanas or poor whites, we take on certain personality characteristics to survive. You know, those are the so-called manipulation characteristics, or the hysteria.
So after,
you know,
excuse me, Pauline,
That's okay.
after a woman, it's been made clear to her that it's not entirely her fault, so to speak.
It's not her fault at all.
Okay, it's not her fault at all, and that it's society's fault, really.
Yeah.
Does then that take away most of the guilt that we all hear about that women feel?
It sometimes does, particularly if then you can put her in a group with other women who are in similar situations, and you don't even need a therapist in that particular kind of group sometimes. I'm not saying you don't need them in other groups. And then they share their experiences. I'm not sure one time would do it, but if they share their experiences and their pain, that I think would be likely to take away the guilt. I do know, for example, with rape, that if you belong to an anti-rape group, the rapist is more likely to be convicted. That is, it helps you be a more effective witness, presumably. And if he is if he is convicted, you are less likely to have symptoms. So these kinds of group activities are extremely therapeutic.
Let's talk about the difference between traditional therapy and some of the newer therapy and feminist therapy. The client-patient relationship, the therapist-patient relationship is different, isn't it?
Yes, it's particularly compared to the traditional therapy, it's less hierarchical. Philip Reif said that the analytic relationship replicated the traditional Victorian father and his daughter, with the analyst being, of course, the father. Some of the newer therapies are at least less overtly hierarchical, although there's always some hierarchy. But feminist therapy in general tries to minimize hierarchical differences between the client and the therapist.
Another difference that I've heard of is that there's active intervention on behalf of the client by the therapist, and this is somewhat unusual.
Well, this is particularly unusual compared with traditional therapy. Yes, the therapist will be more likely to be aware that there is a real world out there. It's not just inside the client's head, as I said, because the problems stem from the real world, and therefore might be more likely to take action against a particularly difficult, say, situation, let's say a landlord or something like that the client is having difficulty dealing with. There also, according to Ruth Pankhurst, is more likely to be sort of involvement in the kinds of body work that are mentioned in a book called Getting Clear, where there may be more focus on things like bioenergetics, on massage, on things like that.
A few minutes ago you mentioned, women getting to know other women and being exposed to other women.
Yes.
How would a feminist therapist go about that?
Well, one of the things that feminist therapists try to do is help their clients see that they really have a great deal in common with other women, and that it is a great joy to work with other women, and that one need not think of other women simply as competitors. That stems from the belief in sisterhood, which is one of the beliefs of the women's movement.
I know there's been a controversy.
I should say that also one of the things that feminist therapists believe is that one can turn to other women for help in times of stress, and that one's friends are very important. Now, I remember reading in the Chicago Tribune that a woman therapist, you see, not all women are feminist therapists, suggested that if your husband didn't like your best friend, you should give up your best friend. Now, a feminist therapist would never say that. She might say give up your husband, as a matter of fact.
But then even she probably wouldn't say that, right?
I don't think she would. But
there's a tremendous amount of controversy on, about who should be a feminist therapist. Should a man be? Should only women be? How do you feel about that?
Well, I think that there are a lot of white people that are very sympathetic to blacks, but just as the white person cannot be black, although he can be sympathetic to blacks, a man cannot be a feminist therapist. Although he may be pro-feminist, he may really like women, he may be very sensitive, he does not have the particular worldview which comes out of being born female in our society and having certain experiences, some of which come out of our biology, and he does not have our biology. Show me a menstruating male, and I'll show you a male feminist therapist.
Okay, I'll accept that, although I think we should acknowledge that there are people that don't agree with that point of view, that
Yeah.
do say that men can be and make fine feminist therapists.
I'm not saying that men can't do therapy with women. I'm just saying men aren't feminist therapists.
Okay, can you be concise about what the goals of feminist therapy are?
Well, the goals of feminist, well, there is some disagreement on this at one point, and I'll tell you that point. The goals of feminist therapy are, in general, to enable the woman to live her life unconstrained, insofar as it is possible in our society, by the sex role stereotypes that have been laid on her. Now, some feminist therapists, and I happen to agree with that position, go one step further. And they say that once she herself is together and is comfortable with herself and is free of these kinds of constraints and inhibitions and in touch with her feelings and in touch with her anger, then she should take her new strengths and put it back into the movement to make the society better so that other women and other women's daughters will not have to experience the kind of oppression that brought her to feminist therapy to begin with. Now, there are some therapists that believe that that is laying your particular political trip on somebody who is dependent on you because of the psychotherapeutic relationship, and that therefore that is immoral. The analogy was made to me by one therapist that I do very much respect, that that's like military psychiatry. You know, you fix them up so they can go back into battle again. Another one, however, said that she wouldn't force her clients to do that. She thinks that that is an extremely therapeutic thing to do because it shows the woman and enables her to that she is not powerless, that she can affect change, and that is a wonderful kind of feeling for a person to have. Also, to be of use and to help other people. That makes your own suffering not so meaningless, because if because of your suffering you're able to transform it and see that other people don't have it, then it's not all wasted.
So you think the politics is important?
I do, yes.
What about, there are many women who would reject feminist therapy for the reasons that you said a second or two ago, that they are afraid that someone else's ideology is going to be forced on them. And you gave me a very good example earlier of why that shouldn't happen when you talked about a young therapist possibly treating someone who is older and with children.
Well, one of the reasons that we want feminist therapy is because we feel that people can be more effective as therapists the closer they are demographically, that is in terms of age, in terms of ethnicity, in terms of where they grew up, with the client. So, since men do live to a large extent in a different world from the world we live in, we think that they really can't understand a lot of the things we do. However, with the same kind of logic, one could say that some of the feminist therapists who are very dedicated, very talented, very sincere young women who for various reasons have, because we know that there's a great deal the matter with the family, have decided not to marry and not to have children, that these women may have trouble relating to, let's say, an older woman who has spent most of her life out of paid employment. I wouldn't say not working, because you work when you're a housewife. I was a housewife and I worked. But, living in the suburbs with, let's say, 4 children and a marriage which isn't exactly wonderful, but which isn't bad enough for her to want to get out of it. Although certainly this young therapist could not tolerate that kind of situation. I think she might have some difficulty relating to that woman. But this doesn't mean that that woman shouldn't have feminist therapy. She might look for a feminist therapist who has had some children, for example. I think that would be very good for her.
From your experience, Pauline, would you say depression is the most common reason that women seek help?
I think so. Depression seems to be the most common symptom that women have, and it is consistently found to be more common in women than in men. And women, I think, are set up by their socialization to be depressed.
There are a couple other things that usually come up during the course of feminist therapy that are dealt with, and one is fear of power. And can you tell us a little bit about that?
Well, most of us are not socialized, brought up in a way to be comfortable with a lot of our strengths. You mean the fact that women are and so to be competent, to be angry, to be assertive, to be powerful is not something that is considered ladylike, and is something that we have been consistently, and still are, because I keep hearing examples of this among graduate students, are punished for. We're told that nobody will marry us if we're like that. So we develop these compensatory kinds of traits, which are indirect, and they take a lot of energy, and I personally have always found them very degrading, although my therapist in the 50s encouraged me to use all these indirect manipulation techniques with my husband. And I said, but look, if he understands what I'm doing, why should I do it? If he doesn't understand what I'm doing, he's too stupid for me to be married to, so I don't see the point. But, you know, I mean, my therapist even wanted me to do that. He said, well, my wife does it. I know she's doing it, but I want her to do it. It's like a minuet. I want her to go through the ritual. At any rate, what a feminist therapist will do is enable you to use the full gamut of your ability and reinforce you, reward you for assertiveness, for aggression. People used to say, well, we don't mean aggression, we mean assertiveness. It's okay to be aggressive too sometimes, aggression, power, etc. But the other thing is, and I don't think this has been dealt with, and I'm more aware of it as I'm becoming more like that, is that people don't talk about how we're supposed to deal with the consequences of this behavior, because it comes down very heavy. And perhaps some feminist therapists are dealing with that now, but I think it's one of the topics that has to be discussed.
Do you think that feminist therapy is valid in a crisis situation?
Why not? It is good therapy. While, there's ordinary crisis intervention kinds of things to do. An example I can think of where the feminist approach was really much better than the traditional approach was one in which a young black woman was brought into a community mental health center having made a suicide attempt. And every time they couldn't get a blood pressure on her, because every time her husband came into the room, her blood pressure went all the way up because she was so angry. Now, the psychiatrist in charge of the case had such a commitment to the nuclear family that he kept, having the husband around, where in fact there was a mother there. The young woman had a very close relationship with her mother, and it would have been much better had the woman and her mother been allowed to be together. And now a feminist therapist I know was there, and unfortunately it wasn't her case, so she couldn't do anything, but she reported that to me, and had it been her case, she would have not had this kind of rigid commitment to the husband, whom of course, I shouldn't say of course, whom it is likely that the psychiatrist identified with, and rather seen that the mother, particularly in that particular neighborhood, was the most important person in the woman's life.
Is anyone doing or thinking about feminist therapy for little girls, using it in work with children?
I don't know offhand, but I could tell you, I know that there are feminist therapists who are child therapists, and I would suspect that once they get out of the simple play therapy kind of therapy, and in the counseling with the mother, they would certainly try, not to squelch the active, assertive girl, and also, to allow the boy to be more passive and not fill the parents with anxiety, if he does exhibit these kinds of traits.
Pauline, we have 2 minutes. Is feminist therapy right for everyone?
Well, it's right, I think, for most women. The one example I thought that it might not be right for would be a woman who wants to work through a relationship with a man who has had a lot of bad experiences with men, and then she might want to have therapy with a male so that she can have, for once, some kind of good experience. And since I said a male can't be a feminist therapist, this would be the exception. But other than that, since feminist therapists really like women, I think that it would be a very beneficial experience for anybody who wants to have therapy. Consciousness-raising groups can be thought of sort of as feminist therapy, and that certainly is something that I would recommend to all women.
Is there any attempt being made to sort of integrate this into the system?
Yeah, I think there is, but I think it would get diluted in the system. I think it is a critical therapy, and as a critical therapy, I think it should be outside the system. What you want in the system is a decrease in sexism. You don't want the kinds of atrocities you can read about over and over that occur to women, and so I think that should be integrated in the system. But feminist therapy is a critical political approach to people's lives, and as such, if it were co-opted by the system, it would be just sort of, it would lose its particular elan. I think I would be unhappy. It is only people who don't understand the politics of it, I think, or have a very naive faith in the system that I think would want to integrate into the
Pauline,
system.
I'm sorry we're out of time.
That's okay.
I thank you for coming very much.
You're welcome.
Thank you for watching, and good night.
Production funding provided by public television stations, the Ford Foundation, and the Corporation for Public Broadcasting.